Zach Easter's girlfriend for a very long time.
My name is Winslow.
You sound exactly the same each time.
He's a dork.
And we are in his bedroom with the story he wrote telling what he went through and how he suffered.
Now that I'm still having post-concussion problems 6 years after my last diagnosed concussion, I figure it's time to get things off my chest about my hidden struggle with depression, anxiety, and headaches.
All of a sudden, his mind betrayed him, and he didn't know what was happening, and he didn't know who he was anymore. He just knew he wasn't the same Zach Easter, and at the root of that, he knew it was because of the concussions he sustained.
Sometimes I couldn't tell which one would kill me first. The depression, anxiety, self-hatred, self-esteem, body image, emotions, and angry outbursts. All I know is I always felt like a lot of my actions are not me.
He struggled silently because he didn't want to tell people what he was struggling with. The day-to-day short-term memory loss, like not being able to function on a daily basis, that's embarrassing for people.
Depression, anxiety, aggression, impulsiveness, and even suicidal thoughts. These are all mental health issues that cause distress to anybody. But did you know that people suffering from concussions not only deal with physical symptoms, but also mental symptoms just such as these? Athletes that may have recently suffered from a concussion or are recovering from one may be suffering from mental health disorders and may not even know it, and we need to address this. My name is Princess Ulona, and I'm going to be able to shed some light on the importance of addressing mental health when dealing with post-concussive athletes, especially athletes in your year in high school. We want to be able to give you the tools to be able to identify any mental health issues in yourself and in other people, and to be able to ask for help when you need it. First, we're going to deal with what is a concussion. What is a concussion? A concussion is the immediate and typically transient symptoms of traumatic brain injury induced by biomechanical forces. The range of symptoms are shown to be a reflection of functional disabilities rather than structural, meaning that it affects how the brain functionally works rather than the anatomical parts of the brain, which is a lot harder to kind of detect how the brain is working. Concussions affect three different domains in the brain: the physical domains, the cognitive domains, and the emotional domains. Athletes that get concussion may experience a wide variety of physical symptoms, such as headaches, dizziness, nausea, and loss of consciousness, cognitive symptoms such as amnesia, confusion, and attention deficit. And what we're going to focus on mostly today is emotional symptoms, such as depression, anxiety, aggression, irritability, and so on, which can lead to potentially dangerous behaviors and thoughts. Post-concussive athletes continue to experience persistent concussion symptoms, to which the severity of them can be perpetuated by their exposure. So how often they play, their history of concussions. People who have had 2 or more concussions have a higher chance of contracting mental health disorders, their history of mental health, and their age. So that means people your age have a higher risk of getting persistent symptoms after concussion in mental health. But we're going to get to that in another minute. A study found that athletes that had concussions, 40% of their symptoms were resolved in 3 days, and 1/4 of them were resolved in a day and returned to play in that same day. However, a majority of behavioral and emotional symptoms, which affects 24 to 85% of post-concussive athletes, don't occur until a few days to a week following injury, and it can take up to a month to a number of years to resolve. So awareness of the importance of mental health in post-concussive athletes are frequently dismissed and has not been focused on, especially with the high prevalence of concussions in young athletes. In 1983, it was reported that alone and high school football athletes were numbered to have 250,000 concussions per year, and 20% of them sustained them yearly. Imagine how many cases of mental health disorders that went unreported just in that population alone. That's absolutely crazy. However, there have been recent media coverage on the increasing amount of high-profile athletes that have committed suicide due to significant mood and behavioral changes following concussions, and making them engage in risk behavior and at-risk behavior that draws public attention to them. This cements the link between post-concussive injuries that happen multiple times and poor psychosocial outcomes of sports-related concussions later in life. Irritability, sadness, lack of concentration, and just feeling more emotional are indications of underlying mental health issues that precede a concussion and can aid in the development of depression and anxiety. This can be made worse by following other things if they have inadequate social support, maladaptive coping abilities, and have an increase in daily stress levels in their lives. So what happens to the brain that causes the changes in mental state? We've already confirmed that head trauma and concussions have been linked with mental health disorders such as the ones previously stated before. And so we need to be able to figure out what in the brain is affected to cause these changes in mental state. So we have a bunch of different regions in the brain that has been affected, such as white matter, gray matter, dorsolateral prefrontal cortex, the striatum, and the thalamus. We're going to expand on that in a minute. The parts of the brain that are affected during concussions are shown to have the same dysfunctional patterns as those who have depression, anxiety, irritability, and any other mental illness. So first of all, the white matter is damaged. So our white matter makes up half of the brain and is made up of a bundle of nerve fibers and axons that link together neurons in different parts of the brain that underlie different functions of the brain. And significant alterations could cause repercussions to the way the brain functions, which is one of the biggest things that is affected from concussions. So that could onset depression, anxiety, and any other cognitive impairment. Furthermore, gray matter. Gray matter density is reduced in the temporal and the frontal regions. These areas are responsible for higher order thinking and reasoning, and multisensory integration and processing memories. So when the density is decreased, those areas are affected. Furthermore, the dorsolateral prefrontal cortex, striatum, and thalamus are important areas that are affected. So what happens here is a dopaminergic neurotransmitter, which is a transmitter that releases dopamine, the happy hormone, into these regions, regulates the neural stability and mental state of the brain. So when there's head trauma, the amount of dopamine that is released in this region is reduced, and that could onset depression and any other mental illness as well. To a lower extent, it also affects a bunch of antidepressive neurotransmitters that help to maintain the brain and reduce the onset of depression. But without it being there, there's a more likely chance of this mental instability in the brain. Overall, all the damages to the different parts of the brain region accumulate to increase the task difficulty due to the increase in task-related energy demands. So therefore, things that they usually be able to do easily before is going to be a lot more harder because your brain has to work so much harder because of all the damages to the brain and all the different regions that help with the functionality of you being able to do tasks is reduced significantly. So next we're going to talk about who is at risk for mental illness after post-concussions. So athletes who are mostly at risk for concussions, by extensions, are at risk for symptomology that affects their mental health are athletes who partake in sports with high exposure to collisions. So we're talking sports such as football, soccer, hockey, cheerleading, wrestling, even basketball, gymnastics, everything else. Anything has a high chance of you injuring yourself, you will be able to get a higher chance of mental illness. Who else is at risk? So people with 3 or more concussions, as said before, during their time to play are always at risk for mental illness. And so with the more incidents of concussion, there's a higher chance that the severity of the mental illness will be there. Furthermore, people with pre-existing mental health issues, female athletes, they also have a harder chance dealing with the behavioral and emotional symptoms, and youth. So this is very important. Youth have a higher chance of dealing with mental illness because there's a higher chance of cerebral swelling that can delay the recovery period. So this can make the symptoms persist. Also, the trauma can affect the brain's cerebral autoregulatory response long term, since the brain is still in the development stages, so there is a higher chance of any like damages to the brain lasting for a very long time, which is just not good. And furthermore, because you guys are youths, you guys don't know how to look for the signs and the symptoms that will indicate that you guys are experiencing any mental health issues, which is something will get you really much increase your risk at um, dealing with this badly. The current attitude towards mental health in sports is the biggest reason why one of the why mental health is not as discussed well in sports culture, and why post-concussive athletes frequently do not report if they're feeling anything close to a mental health issue. With the frequency of this, a crucial part of concussion in high school is minimizing the risk of long-lasting effects. Emotional and behavioral symptoms should be included in this as well. In most high collision sports, they have a culture on the importance of mental health, and this is perpetuated by coaches and peers and can lead to mental illness being seen as a weakness. Athletes also then become less likely to speak up, which is extremely wrong because this is a sure way to make the symptomology of mental illness persist. When athletes cannot speak up about their mental health, it leads to a series of behaviors such as social isolation, withdrawal from the things they enjoyed, guilt that they let their team down, and anger, aggression, and irritability. So how are we going to identify this in yourself and in your peers as well? So to be able to know how to improve the mental health of post-concussive athletes, we need to know how to identify these signs in yourselves and teammates. So we can see that if there's an increase in isolation, if they have increase in anxiety, if they even increase in substance abuse, those are kind of signs that you can kind of see to be able to determine if people you know or yourself are experiencing mental health issues as well. So what can we do? Well, first of all, education is extremely important. So this is for us to be able to know to identify the mental state of others and themselves. A study found that athletes describing post-concussive symptoms were unaware that what they were experiencing was concussive symptoms or mental health issues, which is extremely very telling. So what education will allow us to do is it will allow us for early detection and successful interventions, change the attitude of how mental health is treated in sport, create a safe space for people to speak up and ask for help from others and coach their friends and their coaches, and it lets the athletes know how to detect signs and symptoms as well. Next, social support. So that's something that everybody can do, you and your family or your friends. So being able to validate the pain and suffering of people who are battling this is extremely important. Simply being believed by healthcare providers, peers, coaches, and family members are shown to be a very therapeutic way to deal with this. They're able to transition in life and consolidate their personhood and be able to reconstruct the ideas of who they are as an athlete and as a person themselves. Reaching out should be a normalized way of therapy and should be seen as something that must be done immediately to be able to help people out when you're dealing with mental health issues. And we also reduce the risk of social isolation because we're always surrounded by people that care about us, and reduces the amount of external stress in their daily lives because studies have shown that severity of symptoms and frequency of symptoms have been shown to be proportional to the daily stress level of people's daily lives. Next is psychotherapy. Psychotherapy is a form of cognitive behavioral therapy that helps give the athletes the tools to be able to navigate through their mental disorders that would reduce the latency of their disorders. This helps stop any maladaptive thinking or practices and is very successful in treating depression, anxiety, and sleep disruption. This is also able to allow them to be able to reconstruct their ideas of their personhood, be able to know what kind of be able to reinvent themselves under a new athletic identity that was maybe disrupted by their mental health issues. This must be done by a professional neuropsychologist as they are trained to assess behavioral, mood, and cognitive functioning in post-concussive athletes. The indirect measurement of brain function is important because we are able to establish that cognitive deficit may persist after physical recovery, and it would be an efficient way to determine if there are any changes in cognition, such as mood and changes in other symptomology. And this gives them an opportunity to just kind of review the entire situation in a safe and encouraging environment. To conclude, there's a direct link between the incidence of concussion and the onset of mental health disorders. Awareness is important to detect those athletes that are at risk for these disorders and to be able to provide early intervention and prevent potentially dangerous outcomes such as suicide. I hope that with this PSA, I was able to give you the tools to be able to understand how post-concussive athletes can be at risk for mental health disorders and how to be able to determine what's happening on your peers and others and see the signs and symptoms to reduce the effects on your lives. Thank you and have a great day.